grab people, you know. It's both. It's very terrifying. Sorry, my name's John.
Hello, John.
Hello. Hi.
My name's Ayla.
Okay. I'm Keela. All right. Okay. Just this is Nikki Scott. She's come in feeling a little bit short of breath. I just want to have a word with the doctors first, just before I just wanted to. So she's had previous surgery. I think it was cruciate repair.
Mm-hmm.
But she's quite anxious when I go near her. Okay, so just bear in mind. I don't know if it's a bit white coat or something like that, but she's if you just leave her, if you look now, just look on her, you see she's quite calm. But if you start talking to her, she gets very kind of wound up. And I've told her hopefully she'll be going home.
Right.
Because blood pressure's on the department, she seems fitting well, but like I said, she is getting a bit wound up. So just bear that in mind when you speak to her.
Right.
Alright. I've got notes and things on there.
Okay. And she's been referred by your GP for shortness of breath.
Yeah, shortness of breath. All the details on the notes there.
Fantastic.
Okay,
Grant. When did you first repair? Do you know?
Nikki, do you know when how long ago has it been since you had that repair?
3 weeks.
3 weeks.
Yeah,
So
yeah.
right. I have had to loosen off just a little bit because she was complaining of fluid time.
Okay. Fantastic. Hi, Nikki.
Hello, hi.
My name's Ayla and this is Keelan. We're just
Hi.
some of the doctors and we've
Hi.
come to see what's going on and see if we can what we can do for you.
Yeah.
So can you tell us in your kind of from your perspective what's been going on over the last few days?
Well, like the last 3 years, I went to the GP this morning because I was getting a bit worried about it, to be honest, but I've just felt a little bit more short of breath than normal.
Right.
Like, just when I'm going up the stairs, I'm normally quite a fit person and I just was like worrying about it.
Okay. Okay. And have you noticed this is only kind of when you're exerting yourself, or has it ever happened when you've just been stationary?
I feel as though when I was talking to the GP this morning, I was almost short of breath talking to the GP a bit like that, but usually just with the stairs, like when I'm talking now with it as well. Yeah.
Have you ever had anything like this happen to you before?
No.
No. Okay. And when did it start?
About 3 days ago.
Okay.
Yeah.
And over that time, have you been finding it's getting worse or better?
I'd say possibly getting a tiny bit worse, yeah.
Right. Okay.
Yeah.
I might ask if we could just get a wee set of gloves.
Yeah.
If that's okay.
Nikki, since you had this operation,
Yeah.
what's your walking around been like over the past couple of weeks?
I've been trying to do bits and bobs kind of as what they've advised me.
Yeah.
Obviously initially I couldn't really walk much at all.
Yeah.
Yeah.
Okay. And did
Pull
they
the
send?
team and doing stuff, you know.
Yeah.
Yeah.
And did they send you home on any medications to take at home?
They gave me like injections for my tummy, which
Okay.
I was having them.
Yeah.
Yeah.
And were you still having them until you came into hospital?
Yeah.
Okay. And how does your leg feel right now?
Leg feels okay. I mean, obviously it's a bit like stiff and stuff, but I've got this. They've told me I have to wear this most of the time, so.
Yes.
Yeah.
And the nurse was saying it was feeling tight. Is that just because it was on quite tight, or have
I
you
think
noticed
it's just always been a bit tight, but I don't know really. I was more worried about my breathing.
your breathing? Of
Yeah.
course, yeah.
Just take your temperature there.
Yeah.
With your breathing, have you noticed that it's worse at any particular time? I know you said it's worse when you're
37.5.
Brilliant, thank you. But have you noticed?
Sorry, just before. Sorry for interrupting.
That's right.
Respirator's about 22.
22. Okay.
But it's not. It's been about 12, 13 when we're a little out of class.
Okay. All right. Have you noticed there's any pain when you're breathing?
Not when I'm breathing normally like this.
Okay. When do you take? So I'm guessing there is sometimes some pain, is it?
Sometimes a tiny bit of pain, yeah.
Right. And when do you notice that?
If I'm coughing
Okay.
or if I took a deep breath, I've noticed it as well.
Okay.
Yeah.
And when you have the coughing, do you
Yeah.
bring anything up with that?
No, nothing. Just a dry cough.
Dry
I
cough.
think it's just that time of year. Yeah.
Of course, yeah. Okay. And have you done well in yourself recently?
Yeah, I'm very fit and well. I mean,
Yeah.
I got this done. It was my ACL because I play a lot of football.
Right.
And I thought I've still got a few years left of football in me. Do you know what I mean? So
Yeah.
I thought get it sorted.
Yeah.
Yeah. So I'm very fit and active. Yeah.
Can you do me a favour? Just take a couple of deep breaths for me.
Mhm.
Good. That's good. Good. Yeah. Is that alright?
Would you mind if you got a wee ECG just?
Sorry.
A wee ECG just because she's.
And how was your breathing with that, Nikki, when that was a bit deeper?
Tiny bit catchy.
Do you want to try?
Tiny bit just, but yeah. Yeah.
Okay.
And if we have both on.
Sorry, you.
No, you go. If you go.
And have you had an X-ray yet since you've come in?
My GP said I'd get one, but I've not had one just yet.
Okay.
Yeah.
Okay. And
Just one
so you were at the GP and then they sent you in. What were they worried about with that for sending you in?
They were just a bit worried about my breathing. They just said getting a chest X-ray, so I didn't know if they thought I had an infection or something. I'm not sure. Yeah.
Okay. Okay. Well, me and Isla's going to do is we're going to have a look through the notes,
Yeah.
see what blood tests and stuff have happened before,
Yeah.
and we'll come back and let you know what we're thinking
Thank
and we'll
you.
go from there. Is that
Yeah,
alright?
that's really
Okay.
helpful. Thank you.
Are you in pain currently? Because we can get you some pain relief
I'm not
if
in
you
any
like.
pain. I think I feel a bit worried, but I'm not in pain.
That's completely understandable. I think
Yeah.
especially you've had this operation, your GP sent you in, a lot's happened recently.
Yeah.
All we want to do is make sure we're ticking all the boxes and
Yeah.
making sure we've got a plan in place.
Yeah.
Okay.
Yeah.
Right, we're back over shortly.
Thank you. Thank you.
It's just like it's already dropping. Just a little 18.
Yeah.
Perfect. Okay. Hi, Ellen. Do you mind if I just have a little examination of you? I'll talk you through it as we go. Okay, so have we got a wee cough with one?
Oh, lovely.
Just a dry cough. Yeah.
A dry cough.
Yeah.
Okay. Has that been over the same sort of time?
Yeah.
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 I'm gonna just have a wee listen to your chest, okay?
Yeah.
Just big deep breaths for me. You got some pain in your side, we'll be draining off.
Just a little bit when I take that deep breath.
How many Blake, how many TCIs we have
Okay. And just your heart rate.
and how long? Well,
Does it sound okay?
Yes.
we'll see what's happening. We've got one
That's
vaccine at the moment. I don't know, maybe she might go
What do you think's been going on?
I'm not sure.
Is there anything that's worrying you in particular?
Did you think it's supposed to be today?
It's about 2 seconds. When I did the Capri fellow, it was about 2 seconds.
Do you have
Sorry.
any
Did you think these guys were from on admission?
Just when she's come in.
Okay. And as far as your legs,
If you,
are they
she's fine, if you sit down.
legs at all?
Sit down,
I
breathing
wouldn't
with
say
that.
so. This one's a tiny bit sore when you're just touching it there.
Is it so it's your knee that's had the
I think
My
operation?
knee's sore,
because
but
of
then
the
when you're
research.
touching on there's a little
Okay,
tendon
so it's
there in the
Actually
back.
now,
Okay.
pain and deep breathing. I'm
Fantastic.
worried that this could be a pulmonary embolism that we're missing. I think she's worried, but I think it's quite understandable given the situation going on currently. I think I'd probably like to do some more tests before we send her home on the safe side.
Yeah.
Okay, but
I'm just
but
gonna
our
check
blood
the
scores are
doctor.
okay though.
Thank you.
I mean,
Yeah.
that day down must be out.
I think I think her blood's been okay. Can be reassuring that we're not missing any infections and stuff, but I'm still quite worried clinically.
That day down must be okay. If you, I'm sure they will. Yeah.
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 She's got some pain in her left calf.
Okay. So I think that kind of could point into the direction of the DVT. Do we know if it's red or?
It doesn't look red when asked. I'm sure.
Should we take it off? I mean, she says she's had surgery. I mean, shall I just do a quick measurement?
Yes.
Yes, please.
But I mean, it's going to probably be still a little bit swollen, perhaps. But
Yeah.
That's okay.
do you mind if I just measure your calf?
No,
We'll
that's
just see comparison. Is that all right?
I think it is.
Yeah.
Right. Sorry about this.
She's got a clear cord.
Did they say how long they wanted this
Yeah.
on? Did they
Yeah.
take them on a bit
But she's
longer?
quite a while, yeah. She's still walking in the
Still a little bit.
Yeah.
I'm sure it's red, but when she just when I was examining her, she's like when she's doing deep breathing, she's still getting breathing inside.
I didn't look at the chest X-ray. It doesn't look like there's any obvious signs of infection. It doesn't look clear. I don't know if she has any past medical issue of asthma or anything which could be causing the shortness of breath, but I still think.
And she's saying this one, which is
Yeah.
Okay, so it's 39 there and 36 there.
okay. I think we might need to drop those in the
Yeah. I think as well we could book a CTPA. Okay.
Do you think that's reasonable? We're thinking we drop our CTPA.
A doctor or CTP, yeah.
Just to or T down is fine, but there's quite a lot of clinical suspicion.
Should we calculate her last score? Because I think that would help us.
Yeah.
Please, that's all right.
Yeah, of course, yeah. Have you got my card? Do you want to use Medcalc or whatnot?
Yes, yeah.
Have you got a phone?
Yeah.
Just having a look at all your results and things.
Okay.
Okay.
Thank you.
Were you thinking about doing anything later on?
Well, yeah, I was hoping to kind of watch some TV shows and just little nice things in the house and a little routine. But obviously, if there's something wrong, you know, don't let there be something wrong or anything.
What are you watching at the minute?
Traits.
Oh, are you watching Traders? Everybody's talking about Traders, aren't they? Yeah. So, what are you up to? Are you up to season 3 of it?
Yeah.
Alright. I'm still only up to season 1. It's just seems to be when you talk to her or when you engage with her. Will you just take a few deep breaths for me? Between yours and 3 months. Is that the best so when you're doing
Yeah,
this?
that's all.
I think our Wells Score is 9.
9?
Yeah.
Okay.
DVT, likely diagnosis, more heart rate, more than 100, the memorisation. I don't think. I'll double check actually. Nikki,
Yeah.
have you ever had anything called a blood clot before in your lung?
Not before, no.
No, okay.
Why is that? Are you thinking that could be this? Is that?
So I think with what's been going on
Yeah.
with recent surgery, not being able to move around as much, and now feeling this more short of breath when
Yeah.
you've got some pain with it as well.
Mhm.
I think that's the thing I'm most worried about.
Right. Okay.
I think it could be that that's not the case,
Okay.
but I think it's not something that we should miss out.
Fine.
We can treat it with the injections you've been having. We
Yeah.
can treat it with higher strength with them
Okay.
and monitoring how you go on. And sometimes we can switch it to an oral tablet.
Okay.
I know it's quite scary.
Yeah.
There's a lot going on.
Yeah.
But I think I wouldn't want to send you home
No.
how you're doing now.
Definitely not. Yeah. Absolutely not. Yeah. Thank you.
The way that we investigate this is usually with a jelly scan of your leg
Mhm.
and with a scan of your chest.
Okay.
Do you have any kidney problems?
No, not that I know of. No.
And just while I'm here, have you got any asthma at all?
No.
No. Any issues with your lungs in the past?
No fitting well. Yeah.
So what we're going to do is we're going to speak to our colleagues to get them scans organised.
Yeah.
And I think we'll change your injections to a higher dose.
Mhm.
Do you know your weight off the top of your head?
I think 70 kilograms.
7 kilograms, okay. I'll double check in our systems to see if you have it as well.
Thank you.
Okay, so that's what we're going to do now.
Yeah.
If you feel really short of breath at all, we can give you some oxygen to help. And
Yeah.
if you have any pain, let us know and we'll give you some pain relief.
Okay.
And I think that might help manage your breathing as well.
Okay, that's great. Thank you so much. Thank you.
So should we book?
So, we're going to give them anybody a ring then?
Yeah, should we speak to the med just to run it past?
Mhm.
Run past what our plans are, and then I can phone them out after and get a CTPA book. Is that alright?
Fantastic.
Oh, you have to ring this.
Okay. So, hang on a minute. Okay. I'll just try and remember what the number for the switchboard is again.
5572.
Oh yes, sorry, you've got it.
Hiya, could you please put me through to the address? Thank you. Hiya, do you
Oh,
want to
lovely,
chat about
thank
a
you.
patient? Brilliant, my name's Ayla, I'm one of the junior doctors on ANU. I've got a young woman
She's
who's
gone anywhere.
35.
I don't think so. I think until we can rule out the on the
She's
scan.
coming with shortness of breath.
I just think she's got
with
too many
allergy.
indications
There's quite a
pointing
high
towards
clinical
it.
suspicion
Yeah.
I
of
think there's no sense of
TB.
infection,
She's saying
which
this
would probably be the
tacky,
other big thing on
short
isn't it?
breath,
And although anxiety can present like
chest
this, I
pain,
think
coughs,
she's anxious because of the
and the fact
situation,
that
which
the
I think
Wells
taken into
Score
account
her
makes sense.
D-dimer is normal.
So I think it's probably best to get a CTPA, they're usually quite regularly available.
reasonable to
And
do
then
an
at least then we
ultrasound
know
doctor
for
or a
certain.
CTPA.
Is that alright?
what you would suggest.
So if the CTP does show like positive, well,
Nine.
it's like anticoagulants and things, is that right?
Yes, yeah.
So
It
clinical
can be
signs and symptoms
either
like
we can,
DG.
usually
Oh,
injections
are
are usually quite a lot to take for
surgery,
the
so
serious
she's
symptoms
been
at a time.
normal, but
Where we can switch to
her
an
heart
oral
rate's over
tablet.
100.
And it's usually that she might be able to go to SDEC rather than
That's
admission to
and it's
hospital. Oh wait,
just
we're already
almost like
Yeah,
a
like short-term management, yeah.
Yes, yeah.
yeah, she's
And
stable,
then
she's
usually probably
saturated
follow up in
97. Her blood pressure is normal. It's just her pulse is a bit high.
Alright,
Yeah. Thank you.
So far she had 4 certain bloods, including a D dimer. She's not requiring oxygen at the moment, so we're just going to give her some analgesia as needed. But I think the next, or if you suggest anything else, that would be marvellous. Yeah, it's all fine, and she's got no history of kind of respiratory conditions or renal conditions. It was one of the ligaments in her knee, which
ACL.
her ACL repair. No, not at all. But she's got some pain when you squeeze that calf. Okay. Fantastic. Thank you. So just forgot to ask for the treatment prophylactic. She said to organise a Doppler and a CTPA and start some minoxidil.
Okay, I think it'll be treatment dose all the way